Lassa fever is not new to us in Nigeria. What is new is that it has continued to embarrass us. The first officially reported case came from Bauchi in November 2015.
Like wildfire, Lassa fever sweeps across parts of Nigeria. Figures of suspected cases rising by the day and records of deaths increasing. Lassa fever dates back to the 50s. The virus was first described in 1969 from a case in the town of Lassa in Borno State, Nigeria. Lassa fever is a major public health challenge in West Africa, with Nigeria bearing the highest burden. It is an acute viral hemorrhagic fever. Epidemiological data shows that Lassa fever occurs throughout the year, but most cases are recorded during the dry season in November through May, making it a cyclical virus. The viral infection is carried by the multi-marmot rat, one of the most common rodents in equatorial Africa, found across much of sub-Saharan Africa.
The ventral surface of the rat that you've just seen, if you look at the breasts, you can count them. Then I want to count, maybe you can follow me to count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 on each side of the ventral surface of the rodent. Usually is a multi-mammoth rat, and it breathes like anything. So that's what you've just seen. So what we try to do is to educate the community. We have the rodent, and it is real that the rodent is with us, and it usually breeds surfaces and areas where we have poor hygienic condition. And the message is that ensure your house is of good hygiene.
In 2018, Nigeria recorded over 1,000 suspected cases.
It is important that we continue to remain vigilant, and that as Nigerians we must avoid spreading or drying of food items on the roadside or outdoors. We need to keep all food containers sealed, and our food must be well covered. We must also avoid eating food suspected to be contaminated with the feces or urine of rats or rodents. We must also throw away food partly consumed by animals, and we need to continuously wash our hands and make sure that food items are well prepared.
The nation is again jolted to another outbreak of Lassa fever. In a statement, the Nigeria Center for Disease Control (NCDC) announces stepped-up emergency measures to tackle the rise in Lassa fever cases. As at 24th of January 2020, 195 cases have been confirmed and 29 deaths recorded in 11 states.
Nigeria is currently experiencing Lassa fever outbreak in several parts of the country, with reported cases of fatalities. Latest report from Nigeria Center for Disease Control (NCDC), released on 25th January 2020, has it that 195 confirmed cases and 29 deaths have been recorded in 11 states of the Federation, namely Edo, Ondo, Ebonyi, Delta, Taraba, Plateau, Bauchi, Ogun, Abia, Kano, and Enugu. Out of the confirmed cases, 89% are from Ondo, Edo, and Ebonyi states. Before the recent outbreak, the ministry has taken preventive, proactive measures to improve the overall general sanitation and hygiene situation in the country. The ministry in 2019 established sanitation desks in all 36 states of the Federation, and these sanitation officers are to coordinate sanitation and related activities within their states, liaise with their respective local government environment departments, and report back to the Ministry of Environment. They are also expected to monitor and report Lassa fever cases and other environmental determinants of diseases to the Federal Ministry of Environment, headquarters in Mabushi. The sanitation desks are to be replicated in all the 774 local governments in the country. Citizens are advised to imbibe good sanitation and hygiene practices and take preventive and control measures that include 1. Keeping the environment clean to avoid contact with rodents. 2. Keeping food away from rodents. 3. Storing grains and other foodstuff in rodent-proof containers. 4. Disposing waste regularly and far away from the home. 5. Cooking all foods thoroughly. Blocking right heart out, deratization, and to avoid and stop eating rats as much as possible.
The Director General of NCDC, Dr. Chikwe Ihekwazu, discloses that out of the confirmed cases, 89% are from Ondo, Edo, and Ebonyi states, stressing that the increase in the number of cases at this time of the year is not unusual due to ecological factors.
Lassa happens continuously throughout the year. What we have are peaks in the months from December to around April. For this year, we've just had just under 268 cases and about 60 deaths. So we continue to work to count this every day. Now, the states where we have the most cases, in fact, about 85% of all cases are reported from Ondo, Edo, and Ebonyi states. And these states have actually become very good at managing these cases. You'll be impressed at the treatment centers and at the labs in Owo, in Ebonyi, Abakaliki at the Alex Ekweme Teaching Hospital, or in the Federal Medical Center Owo. So we really have a group of colleagues that have become very good. Where we have problems sometimes is when there's a new case in a state that hasn't had to deal with this for a while. So recently, over the last few days, we've been supporting the Kano Teaching Hospital in Kano, where they had 2 cases in healthcare workers. And there was a lot of anxiety. So we have a team in Kano at the moment, supporting the teaching hospital, making sure that people's anxieties are allayed. We know what to do. The issue is that we have to do these things consistently. So Nigerians are used to being very reactive. We have to tell our colleagues, and this is a message that we preach all the time, we have to use gloves all the time. It's not just when we think that there's Lassa around. Nobody comes in with Lassa written on his forehead. So it's a continuous education exercise for citizens, for hospitals to do the right thing.
Health officials say many of those affected by the virus do not develop symptoms, and when symptoms occur, they typically include fever, weakness, headaches, vomiting, and muscle pains. Less commonly, there may be bleeding from the mouth or gastrointestinal tract. Diagnosis based on symptoms is difficult. Confirmation is by laboratory testing to detect the virus's RNA, antibodies for the virus, or the virus itself in cell culture. Other conditions that may present similar symptoms include Ebola, malaria, typhoid fever, and yellow fever.
To completely eliminate this virus, we don't have a vaccine for Lassa. So we have to continue doing those things that we've been preaching every year. But there have been some successes. The current case fatality ratio, i.e. the number of deaths that we see from Lassa, has gone down to 17% from 25% a few years ago. We've had a significant reduction of the number of healthcare workers affected over time. So, I think this is the time of the year. Our message to all healthcare workers: if you ever, treated patients without testing or did not use universal precautions like gloves, now is the time to do what you need to do yourself as citizens, as doctors, nurses, to reduce the risk of transmission. And we have supported and continue to support different states in Nigeria, the teaching hospitals, to be well equipped to respond to this outbreak. We think we're in a good place, but every year there's a lot of anxiety. But we'll keep training, educating, and equipping Nigerians and our clinicians to understand what they need to do, why we provide them with the technical expertise, the drugs,
and all the equipment we need to deal with this disease.
There is no vaccine for Lassa fever. Health experts say prevention requires isolation of those who are infected, while treatment is directed at addressing dehydration and improving symptoms.
The good thing is, from the side of NCDC, we've been supporting the management of Lassa. Management of Lassa is very expensive. It costs close to #1 million to manage a single patient. And there has not been a single case of Lassa in Nigeria confirmed that hasn't had the treatment supplied to the hospital. We provide hospitals with personal protective equipment, with technical expertise, with everything else they need to manage these cases. So we have ensured that over the last 3 years, we've had no stockouts, both on the diagnostic side and on the treatment side. But what we now need to do is to make sure that this capacity extends to every state in Nigeria. Every tertiary hospital in Nigeria needs to be able to manage this until we get further in the development of a vaccine, and efforts have started. And that will really provide us a tool to deal with this disease. But until we get there, we have to get better at the basics. And this has really been the message that we've been trying to spread all over the country.
Health workers are not immune from risks as they carry out their routine duties to save lives. So far, 2 doctors in Kano State have died while diagnosing a pregnant woman.
40,000 doctors in Nigeria in a population of 2 million people. What I mean to tell you is, if I will tell you the truth, you barely have about 15 to 20,000 practicing physicians in Nigeria in a population of 200 million people. Meaning, if we are being generous, 40, you have 1 doctor to 5,000 population, which is against the recommendation of 1 doctor to 500 population by WHO for Nigeria, developing country like Nigeria. 1 to 600 population. Now you're having 1 to 5,000. And even that, you are losing them to epidemics like this because of poor leadership. It's just not tenable. It's not acceptable. Look at many doctors and healthcare workers are leaving the countries in brain drain, in droves. You see them in large numbers. Every year, about 2,000 doctors are leaving Nigeria for greener pasture because of poor leadership. As I'm talking to you, all healthcare providers in all tertiary institutions in Nigeria, they get only 5,000 naira as their hazard allowance per month. As we are talking today, in Kano with this epidemic, 2 doctors lost their lives. A doctor is already on isolation, improving, doing well. And also another nurse and another healthcare provider are also in isolation. And even in Jigawa, there is a case of a doctor who has been brought down to the isolation center in Kano. So all these risks that these healthcare professionals undergo, whether you are a professor or you are the youngest, a cleaner, you get 5,000 naira per month. You see, this is far, far, far from what is expectable in a global best practice.
5 laboratories across the country now have the capacity to identify the virus, including the Irwa Specialist Teaching Hospital in Edo State, Federal Medical Center in Owo, Ondo State, and the Alex Ekweme Federal Teaching Hospital, Abakaliki, reducing the time between identifying a suspected case and confirming, even as other challenges stare health workers in the face in containing the disease. Some of the things told to do in preventing Lassa fever include washing hands regularly with soap and rinsing under running water, keeping houses rat-proof, and storing food in rat-proof containers.
First of all, you carry enough of the hand sanitizer. You rub palm to palm, then palm to dorsum, vice versa. Okay, then you clove your fingers, then you take the thumb, another one, then you take the fingers. So the issue here is to make sure that you have enough of the hand sanitizer. Make sure you cover all your hands, both back and front. including between fingers and nose veins.
Cross River State would rather work towards preventing an outbreak of Lassa fever. The government launches an awareness campaign and preventive measures, taking it close to the border community between the South-South state with Ebonyi in the southeast, where the virus is reportedly detected.
Avoid the spread of rice, gari on the floor to dry it. That's not the appropriate thing to do, because as you do that, those rats will come in. As they burn their farms, preparing for the next farming season, it makes those rats to leave from the bushes and come into town. So they must block all those leakages, block all those holes where the rats coming from, ensure that they rid their homes of rodents, ensure they have proper personal hygiene, environmental hygiene, and indeed look out for one another.
Right now, any fever is a suspected fever. We suspect any fever currently, and so we've been able to inform them that they can always run to the health facility to receive healthcare services if there's any suspected case of fever. And on our own part, as the primary healthcare agency, because we have a government who is very responsive, we have commenced training of our healthcare workers just to ensure that we are prepared and we are not taken unawares. And that's why we've commenced training right from South, Central, and the northern part of the state.
In Yola, Adamawa State in the north, the scare is real, and residents appeal for more enlightenment, especially in the rural areas where living condition is poor.
After laboratory testing, the woman from Numan local government was found to be positive of Lassa fever. The public is hereby advised to immediately report suspected cases to the nearest health facility to them, or call the state emergency operation centers as designated.
It's not enough to tell people that there's an outbreak. You need to tell them how to protect themselves. That's the most important measures now. And we hope by the grace of God, God will see us through this crisis now.
Going out to get things to buy, you should be very careful what you're buying and then what you eat, what you take in, because you might go out there and get what will now infect you.
All their contacts are traced and then followed up to ensure that they don't develop any sign of symptoms of this disease.
The Ministry of Health in Kano State keeps the public abreast with every necessary information with the aim of curtailing the spread of Lassa virus.
Measures instituted include: 1. Reactivation of the State Isolation Center at Ergaya, activation of Rapid Response Team, conduct of State Emergency Preparedness and Response Committee meeting, prepositioning of drugs and other consumables needed, contact tracing, daily coordination meeting at the State Emergency Operations Center, that is EOC, among others. Additionally, Kano State government has planned to further intensify Lassa fever surveillance in the state through engagement of traditional and religious institutions, production and airing of jingles, sensitization of health personnel, production and distribution of IEC materials, and conduct of burial rites in line with standard protocols.
While the nation is battling to curtail the spread of Lassa fever, there is high alert to stop the importation of coronavirus into the country. The Federal Ministry of Health increases surveillance in major entry points, particularly at the nation's international airports.
Passengers arrive from the aircraft, they pass through this gate for screening, and we stop them there. One after the other, they will be coming to show themselves to the camera, and the camera will show their temperature one after the other. If it is normal, we allow the person to go, and if it is too high, if it is high, we stop him for we excuse him to a holding area, we call it. so that we can give more examination to him or her.
The committee shall comprise of critical stakeholders in the health, security, aviation, and transport sectors, and also include development partners. Bearing in mind that air travelers, rather than land border crossers, are more likely carriers of this type of virus, attention will focus largely on our 5 international airports. The Port Health Service is currently implementing measures at these points to forestall importation of the coronavirus to Nigeria. And also there's a focused visual observation of passengers who may be showing signs and symptoms of being unwell. Where any passenger is observed to meet the slightest index of suspicion, he is politely invited to step aside for a chat, where his travel history will be obtained.
The World Health Organization is scaling up preparedness efforts in the African region aimed at containing coronavirus, now declared a public health emergency of international concern. Active surveillance, early detection, isolation, and case management.
We would have seen many more cases outside China by now, and probably deaths, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world. The speed with which China detected the outbreak, isolated the virus, sequenced the genome, and shared it with WHO and the world are very impressive and beyond words. So is China's commitment to transparency and to supporting other countries. In many ways, China is actually setting a new standard for outbreak response, and it's not an exaggeration. I also offer my profound respect and thanks to the thousands of brave health professionals and all frontline responders who, in the midst of the Spring Festival, are working 24/7 to treat the sick, save lives, and bring this outbreak under control.
Contact tracing and prevention of onward spread of coronavirus have also been advised. There are many links between China and the African continent where the virus emanated from. 13 top priority countries include Algeria, Angola, Cote d'Ivoire, the Democratic Republic of Congo, Ethiopia, Ghana, Kenya, Mauritius, Nigeria, South Africa, Tanzania, Uganda, and Zambia, which either have direct links or a high volume of travel to China. To ensure rapid detection of the novel coronavirus, laboratories which can test samples must be in place. But as it is, the WHO says there are currently only 2 referral laboratories in the African region which have the reagents needed to conduct such tests. Unlike Lassa fever, WHO recommends that to protect against coronavirus, people should practice good hand and respiratory hygiene and safe food practices, covering the mouth and nose with a tissue or sleeve when coughing, avoiding close contact with anyone with flu-like symptoms, cooking food, especially meat, thoroughly, and avoiding direct unprotected contact with live animals. As of 30th January 2020, there were over 700,000 confirmed cases globally, with the vast majority in China.